Welcome everybody to our MSc Diagnostic Radiography pre-registration webinar. I want to say a warm welcome to you wherever you are in the world and whatever time it is. We are so pleased that you have joined us for this really informative session. My name is Hannah Bennett and I'm the Recruitment Conversion Manager for the School of Health and Life Sciences here at Glasgow Caledonian University. And today we are joined by Lucy Trinder, who is the Programme Leader for the MSc Diagnostic Radiography Pre-Reg programme. So Lucy will be delivering a short presentation to give you a wee bit of an insight into the programme, followed by an opportunity for you to ask any questions that you may have. So please feel free to post your questions at any time using the public chat, and we will do our best to answer as many as we can during the Q&A session at the end. Just a quick note that today's session is being recorded and we will share the recording and presentation slides with you afterwards, so you'll have everything that you need to refer back to. So I'll now hand over to Lucy and I will go away. Thank you. Thanks, Lucy.
Thank you, Hannah. Hello, Ibrahim. I've just seen your message on the chat. Hello, lovely to see you virtually again, and hello to everybody else. It's lovely to meet you. As Hannah has said, my name is Lucy and I am the Programme Leader for the MSc Pre-Registration Diagnostic Radiography Programme at GCU. So I'm literally just going to start with just a general overview of the programme, because I realise that the amount of information online is a little bit limited. So in terms of diagnostic radiography at GCU, we are a very well-established programme. So while the pre-registration course has only been running for about 5 years, diagnostic radiography at GCU has been running 20 years plus. So it's very well established. We've got really good links with our clinical partners. So particularly Greater Glasgow and Clyde in the west of Scotland, we've got very strong links with them. We have a lot of really exciting facilities on campus. So namely our Samsung X-ray room, which is a digital X-ray room, and it mirrors the X-ray equipment that you would experience in our clinical sites. And we are a programme that is accredited by both the Society of Radiographers and the Health and Care Professions Council. So just to elaborate on that a little bit, the Society of Radiographers is our professional body, and Health and Care Professions Council is our regulatory body. So in order to work as a radiographer in the UK, you would need to be registered with the HCPC. So not only are we accredited by these organisations, we have very strong links with both of these organisations. So, for instance, one member of the teaching team is actually the chair of the Scottish Society of Radiographers, and we have another member of the team who sits on quite a few HCPC panels. So we're a well-established course with lots of different links. We are also a high-ranking course, a high-performing course. So you may have seen this information online, but GCU has been voted #1, the top modern university of the year by the Daily Mail. Diagnostic radiography at GCU has also been ranked #1 for the past 4 years. And various different members of the teaching team have been nominated on multiple occasions by the Student Association for Teaching Awards. So hopefully from these slides you will see that if you come to GCU to do diagnostic radiography, you're in very good hands. So I just want to talk a little bit about what radiography is and what you can sort of expect from the profession. So essentially, as a radiographer, you will sort of carry out imaging procedures and image interpretation to define a wide range of pathologies and trauma. So in terms of what that means in regards to modalities, you would be working with X-ray. So that would be in trauma situations, using fluoroscopy. You would be working in the interventional suite, in the operating theatres, going up to wards, do mobile imaging on patients. As part of the course, we would also teach you CT, MRI, nuclear medicine. And whilst ultrasound and mammography, which is breast imaging, would usually require some further study post-qualification. We would teach you all the theory of those modalities during your pre-registration course. So, we would teach you how ultrasound works. We would, teach you how to interpret ultrasound images and things like that. Part of being a radiographer is using very cool equipment, some cutting edge equipment, and you'll see that equipment being used in our clinical sites when you go out. I'm going to talk about clinical sites a little bit later on, but you will essentially do a combination of standard clinical placement in a cluster site and specialist placements. So if you don't see some of this cutting edge technology in your cluster site, you certainly will see the technology when you're out on your specialist placements. And as a radiographer, you are an integral member of the multidisciplinary team. And this is something that's really important to know, as you come onto the course. Radiographers don't work on their own. We're part of a much bigger healthcare group. So we work really closely with doctors, nurses, physios, other health professionals, basically so that we can provide the best care we can to our patients. And I guess that's the final thing to say, is that radiography, and sometimes people sort of forget this a little bit, that patient care is at the heart of everything that we do. And certainly when you're on the course, we will do a lot of things relating back to patient care. It's also a profession that you can expand upon sort of as you qualify. So many diagnostic radiographers have expanded their roles to become advanced practitioners and beyond. So many radiographers become reporting radiographers. So this would involve doing a postgraduate qualification, but it would allow you to essentially report on an image in a way that a radiologist would normally do. So in Scotland, reporting of upper limb and lower limb x-rays and chest x-rays is the norm, but there are more and more radiographers who are starting training in reporting things like CT and MRI. So it's a profession that's always evolving, it's always changing. Some radiographers are going into sort of discharge-led qualifications, patient assessment, research and audit, image interpretation and commenting, and things like academia. So one advantage of being a radiographer is you will never get stuck in a corner. There is always different opportunities to develop. And if you find yourself doing something that you don't enjoy, well, that's okay. You can go off in a different opportunity, into a different direction. And it's also a role that is in demand, essentially. So radiography is a profession. We are very short of diagnostic radiographers across the UK. We work very closely with our clinical sites in the west of Scotland to make sure that our graduates essentially have all the skills that they need to hit the ground running once they qualify. So as soon as you were to finish the pre-registration course, you would be eligible to register with the Healthcare Professions Council and work as a radiographer. And you would start on the NHS Band 5, which at the moment is just under £32,000. So it's a decent sort of starting wage that you go into. So just elaborating on the course a little bit more, it's a 2-year course, and every year we have a cohort of about 15 to 20 students. Now, the big advantage of doing the pre-registration course and having these smaller numbers is that you get to know your peer group really, really well, and we get to know you really well in as well. So, our pre-reg students, they're a really good group. They're really good friends with each other. They socialise with each other outside of the course. They are really good support network for one another. As part of the course, you will be required to do an interprofessional module, And again, that's a really nice way of getting to know other students on different health courses. And one thing just to bear in mind is in regards to the course, it's about a 50-50 split between academia and clinical. So radiography is a very practical profession. You really need to be in the clinical environment in order to put all the academic theories that you've learned in the university into practice. So about half of the course is clinical placement, and I'll show you the breakdown of the modules. So this is essentially how the course runs at the moment. So there's a spelling error here, so I do forget this formatting error. This should be 3 to 4 days in academic trimesters rather than 3/4 of a day in academic trimesters. But essentially, the course runs over 2 years and it's split into sort of 3 sections for each year. So you would start in January in trimester B. Over the summer, you would have trimester C. And then in the following September, December, you would be in trimester A. And it's sort of back to front because it sits outside of the normal sort of academic pattern, which is September to September. So right from the beginning, you will be learning anatomy and physiology, radiographic principles 1, which is essentially the X-ray tube and how it works and how radiation works and how radiation interacts with the body. All really important things to know before you start X-raying people. And the final module here is preparation for radiographic practice. And this is essentially where we teach you how to be a radiographer. So, you know, what X-ray pictures are we taking? How do we take them? And things like that. What I will say is that it is quite an intensive course. You will be in sort of 3 to 4 days a week for the academic trimesters. And because it's quite intensive, there isn't much filler. So everything that you are taught is stuff that you really need to know in order to be a radiographer. So I would strongly advise, if you are coming onto the course, that you're there right from the beginning. And if you can attend induction, that will really help you navigate the university, navigate the course before we start teaching, because we usually start teaching the Monday of week 1. And if you come in a bit later, you know, it's sometimes a bit tricky to catch up. So that's your first sort of trimester here. You would then start clinical placements in the summer, so in June time, and you would continue your placement until the end of Tri A. So sort of from Tri C to Tri B, you're doing a mixture of academic and clinical. Now, in terms of your days, when you're in the clinical environment, you will be working 37 hours a week usually. That would start off being sort of 9 to 5 for the first few days, but then as you progress, you will be doing the shifts that the radiographers would work in the hospital environment. So you might be doing 12-hour shifts, you might be doing weekends. In year 2, we also try and get you to do some night shifts as well. And the reason for that is that the radiology department works in quite a different way outside of 9 to 5. And in order for you to qualify with all the skills that you need in order to be a really effective practitioner, you know, as soon as you qualify, you need to do these out-of-hour shifts to get all the experience you need for qualification, essentially. And then the remainder of year 1 is your interprofessional module, pattern recognition for radiography, which is your image interpretation module, and radiographic principles 2, which is where you learn about our sort of more specialist modalities such as CT, MRI, ultrasound, and things like that. And then year 2, you have the dissertation module, which spans the entire year. Radiographic Principles 3, which is where we focus particularly on oncology and patient care. And then Radiographic Principles 4 is really about leadership, mentorship of others, and the developments in the radiography sector. So that's essentially how the 2 years look. I guess the other thing just to say, which I maybe should have mentioned in an earlier slide, is one thing that really sets GCU apart to other universities is the experience of the staff. So every single member of the teaching team has quite extensive clinical experience, and we can link that experience through into what we're teaching. And again, it really helps you understand the relevancy of what we're teaching in the university to your clinical placement. In terms of teaching and learning, we use a variety of different sort of techniques, so lectures, tutorials, scenario situations, and things like that. GCU has an ethos of what we call widening participation. So in our teaching, we try and ensure that we are adapting our teaching to students who may have a neurodisability, who may have diversity of some sort, so that we're using a wide variety of different techniques to help you learn in the best way. So we do use a variety of different teaching methods. And again, one sort of strength of GCU is that every lecture we have is supported by a tutorial, which really helps you understand the material a lot more. So for instance, I've literally just taught the Year 1 students physics of CT. So they have their sort of 2-hour lecture in a big lecture theatre, and then what we'll have is a tutorial. And in the tutorial, we'll do various different tasks so that the students fully understand, the main concepts of the CT scanner, so that when they're in the clinical environment, they understand about changing parameters, they understand about the radiation dose, they understand about patient care and things like that. So I think that really sets us apart from other universities who are maybe more lecture heavy. And this is also sort of rolls over into our assessments as well. So we use a variety of different assessment techniques. So coursework, so written essays and things like that, exams, practical-based assessments, and clinical assessments as well. So staff in the clinical environment will be assessing your clinical competency as you progress through the course. Again, we use a whole variety of different assessment methods. So we use things like vivas, presentations. We also have something called a health fair for one of our modules. So a student would sort of prepare sort of a public health type a push, and they would present it to a whole group, and that's usually really effective as well. So we use a whole variety of different techniques in the programme. And then a large part of what we do is practice placements. So as I said before, about 50% of the course will be taken up by placements. When you're working in the clinical environment, you will be supervised by clinical staff at all times. And another good thing about GCU is a lot of the staff that work in the clinical sites that we use are GCU graduates, and so they understand the demands of the course and they understand the assessments that you need to complete. As I said before, you have a variety of shift patterns. It will start off being sort of 9 to 5, and then as you progress, sort of long days and weekends and things like that. You are required to attend 100% of your placements. If you are sick for a day, and everybody gets sick, and that's absolutely understandable, we would reschedule that day for you. So you have to complete a certain amount of clinical days in order to complete the clinical modules. And a big thing to bear in mind is that when you are out on placement, you are treated as an NHS member of staff. And as such, you are expected to adhere to all the policies that apply to NHS staff. So things like confidentiality, data protection, all of those things. And we will teach you about that before you go out into clinical placement. So these are the sites that we use. So they are all in and around the west of Scotland. We are really lucky that we have such close ties to Greater Glasgow and Clyde. So we send our students to the Queen Elizabeth University Hospital, which is one of the biggest hospitals in the west of Scotland, the Royal Infirmary, Wishaw Hospital, the Royal Alexandra Hospital. We also have a variety of different specialist placements in and around Glasgow as well that you would expect to attend as part of your studies, again, in order to obtain all the skills that you need. In level 3, or the second year of your course, you have the opportunity to undertake an elective placement, and this is something that the students really enjoy and feedback very positively about. So you can go sort of anywhere you want, really, for electives. Some people choose a site where they want to potentially work in the future. So it might be a site that you've not particularly been allocated, so you can do an elective there and see how you like the hospital before you apply for a job. But a lot of our students choose to go abroad to get, a wider clinical experience before they qualify. So recently we've had people in Malta, in Australia, Egypt, France, all sorts of different places, which has been really, really fantastic. And I think for some of them, it's been really eye-opening to see how different health organisations work in different countries. So you would have the chance to do an elective placement in your second year of study. And again, with radiography, there's lots of international opportunities as well. So many of our graduates have gone on to work in Australia, in Canada, all sorts of different places. So it is a profession where there is a lot of employment opportunities as well. So there's further information about radiography available from these different websites. So in particular, the Society of Radiographers is a really great resource. And then just the final things to talk about. I mentioned that when you go out onto clinical placement, you're treated as an NHS member of staff. As such, before you go out, there's a variety of different checks that you would need to do before you're able to work in an NHS environment. So we would need to get you to do something called a Protection of Vulnerable Groups check, which is also known as a DBS check elsewhere in the UK. This is essentially like a police check. But for this course, we would need it to be done at an enhanced level. So even if you've had a PVG or a DBS elsewhere for a different role that you've done, when you come onto the programme, we would redo that at an enhanced rate, just so that we've got it before you go out to clinical placement. And we would also require you to undertake an occupational health screening as well, just to make sure you've got all your vaccinations and things like that. So you can follow us on social media, and these are the various different handles here. You may also want to have a look at the GCU Radiography Society, which is run by our students and gives you a bit more information about what our students do and the opportunities that they receive. But essentially, I know I've been talking a lot, so I'm going to open for questions now. So if there's anything else that you want to know about, then please do let me know. I know I've really rushed through those slides, so I may well have missed a few bits and pieces. So please do type in any questions. Hannah, is it on the public chat that people can add their questions?
It is. It's on the public chat. That was really great presentation, Lucy. It was very informative. I was keeping a wee eye in the chat just to see if there was anything coming through, but we don't have anything yet. So we'll sit here for a wee bit. And if you want to add anything into the public chat, then I will read it out to you.
No, that's good. Yeah, fantastic. And just, the other thing, I'm going to just scroll back just to talk about the structure. And obviously, if you do have any questions, please do put it in the chat while I speak. Just going back to the module layout. So what I found previously is that people coming onto the course often have very different experiences of education. So sometimes people have done lots of, essays in their undergraduate degree, maybe they've done lots of exams, but occasionally we have students who are a bit nervous. So, if you've done lots of essays in your undergraduate degree, you might be quite nervous about doing exams because that might be a new thing for you. So we've tried to account for that in how we run these modules. So essentially, we come in assuming that you don't know anything in regards to essay writing and exams and start you from the beginning. So with these modules here that you would begin right at the start of the course, we are getting you to undertake a variety of different assessments so that we can see where you are. So for instance, the preparation for a radiographic practice module, I'm getting you to write an essay regarding reflection and the importance of reflection in the professional environment. And there's two sort of aims for that, obviously to meet the learning outcomes, but one, so I can see what your essay writing style is like, and two, what your ability to, how you can reflect on your professional practice. And essentially at that point, what we will do is identify any particular needs that we think you might have. So for instance, if the essay writing isn't kind of where we would want it to be, we would get additional support in from the Learning Development Centre, which is a supportive department that we have in the School of Health, where essentially you would have professionals showing you how to write an essay and helping you with any difficulties you might have in that regard. Similarly, for RP1, you will have an exam. And again, we do this so that we can identify any needs you may have in regards to exam writing and exam technique and revision skills and things like that. And again, we would add more intervention to help you so that when you move into try C and then try A, you're developing your skills slowly. And we would sort of signpost any other supportive services to you at that point. Because GCU has this widening participation ethos, there is a lot of support at this university. And I actually used to work at universities down south in London, so I know what other universities do, and the support we give our students is way and above what my other universities used to do. So if you find when you come onto the course that you're really struggling in terms of coming back to study because it's been a while since you did your undergraduate degree, again, please speak to the LDC. They've got all these different resources available to help you. Similarly, if you're finding the strain of being away from home or being away from family quite difficult, we've got an absolutely fantastic student wellbeing team at GCU. If you have any health issues, we've got the disability team who can sort of step in and support you as much as possible. And what's really good about the disability team is that they work with us as your teaching team and the clinical sites to make sure that you have all the support you need, not just in the academic environment, but in the clinical environment as well. So I've just seen, and this one, Ibrahim just saying in the chat
Ahmed has said, is it possible to work as a radiographer assistant and study this course at the same time? And is there a chance to find work while studying?
Yes, absolutely. So I knew this was going to be a question that came up. Ibrahim, I saw you at the open day the other week, and I spoke to some of our current students about what work they do and how they fit it in. So yes, most of our students have a part-time job as well as studying for the degree. So I think the key thing is the degree is intense, but it's particularly in the academic trimesters, they certainly can fit in their part-time work. So some of our students work as healthcare assistants in the hospitals, and they can do that on a bank basis as well. So they can pick up shifts whenever they need to, sort of reduce their shifts down should they need to. Some students who are able to do work from home, so we've got one student in, he does sort of a marketing role on the side. He finds that quite helpful because particularly in placement, you're on your feet the whole time. There's quite a lot of things to do. So he finds being able to work from home, doing these additional part-time jobs quite useful. GCU do run a part-time job workshop. I think that the whole university sort of runs it. It's a university-wide thing. I think potentially by the Student Association, they might run it. But the whole idea of that fair is to help students find part-time work that they can then fit around their studies to help support themselves better financially. But yes, certainly being a HCA is something that a lot of our students do as well as studying. Hopefully that's answered your question, Ibrahim. And I'm just going to nip up because I think there was a second one.
Yep. So I've just had a look at that second question that's came through. So I think that's actually discussing a personal admissions question. So I've just asked if that person could contact our admissions team or our student inquiries team. So we won't be able to discuss specific applications, obviously, on a public forum like this. So if you could just give them a wee email. So it's inquiries@gcu.ac.uk and they can explain a wee bit further. All right, no problem. So the next one that came through is, hello, is this programme open to international students already trained and qualified as radiographers in their home countries?
So that is a really great question, Angela. I hope I pronounced your name correctly. No, it's not. So the best way, so if you are already qualified as a radiographer, you may want to contact the HCPC, which is the Healthcare Professions Council. You may want to contact them directly to see if your home qualification will allow you to re-register in the UK to allow you to work in the UK. If not, the programme that we would advise you look at is the MSc Diagnostic Imaging. I appreciate there's a lot of similarities in the name, which can get a bit confusing, but that is a programme designed for qualified radiographers who wish to supplement their clinical skills. So you do modules in research, but then you would also specialise in something like CT, MRI, etc. So have a look at the MSc Diagnostic Imaging programme at GCU. That would be the one I would direct you to. But this particular programme, I wouldn't recommend for you, Angela, no.
So the next one that's came through is from Nicole, and they have said, can I do placement in Ireland in year 2?
So thank you very much, Nicole. So certainly for your elective, yes, absolutely. For your main cluster site that you would undertake across sort of Tri-C here, so where we've got year 2, the PPA3, PPA4 placement, for those placement days, that would need to be a GCU accredited site. Now, the reason for that is to do with how the course is accredited. So you can't just have a university that says, I'm going to run a radiography programme. Because we've got a professional body and a regulatory body, they have to come and check that everything that we teach is up to a particular standard. And that extends to our clinical sites. So each of our clinical sites has been approved for use for GCU students. Similarly, if your university is an island, your sites there will be accredited to those Irish HEIs. But you can absolutely certainly do your elective placement, which comes at the end of year 2 in Ireland. Absolutely. Hopefully I've answered your question, Nicole. If you do have another one, please just come back in.
So we don't have any other questions just yet. This will be a kind of a wee final call for any others. If you want to just add them into the chat box, we'll stick around for a wee bit longer.
Even if you have a question over some of the slides, because I do realise I did go over them quite quickly. So if there's something I said that didn't make any sense or you just want me to expand upon, please just, pop it in the chat. Oh, I can hear someone. We can't hear you very well. So could you pop your question in the chat instead? Is that okay? Sometimes it's the bandwidth on these things that are... Lovely. There's another one here, Hannah. Are you happy for me to read it? I don't want to.
Yep, sorry, I missed it. I
No.
muted my microphone because I actually think it's me. I'm getting trees cut down outside my house. I think that's what you could hear. So I muted the microphone.
It's okay. I don't have a strong background in science from my previous studies. How much preparation would I need for this course? Would it cover the basics from the beginning? Yes, it would. You don't need to do any sort of revision or anything like that. So as I say, this course, the pre-registration, this intensive course is run for about 5 years. The absolute star pupil from year 1 had a previous degree in music, but picked it up and essentially got top marks in every single module. She was absolutely amazing and is an amazing radiographer now, working in one of our local clinical sites. So no, we would start you off. And with the modules, we assume nothing. As we talked about the exams and the essay writing, we know that people are going to have different backgrounds. And in a way, that's really nice because everyone's a bit different and everyone learns from each other. So when you come onto the course, the first few modules, we are taking you down to sort of the bare minimum, really. So we will explain things about the X-ray beam and the physicsy bit and all of that kind of stuff. We will take you through that step by step. And I think the other thing just to say is in relation to the physics aspect is, I've been a radiographer a very long time and I have been a lecturer a very long time. And it used to be that we taught radiation science with equations, and because that's how physicists, interpret things and teach them and things like that. What we were finding, though, is that students had a tendency of memorizing equations, but then couldn't really equate what that equation meant in the clinical environment. So now when we talk about radiation science, we're talking about concepts. We're explaining the concepts. We're explaining the concept of the X-ray beam, and then you're seeing the X-ray beam being used in the simulation suite in our X-ray room. We've also got a theatre, so you're using the image intensifying machines in the mock theatre that we have in the university. You're then seeing it being used in the clinical environment as well. So when you put all of these things together, that's how you build your knowledge up in these areas. So essentially, to your question, no, it doesn't matter if you haven't got a science background. We'll take you through it step by step. And a lot of what we are teaching are concepts rather than hardcore science. It's all linked to the profession, essentially. It's all linked to clinical practice. So, and again, in the chat, please say if that doesn't make sense or you want me to expand or what's it. That's absolutely fine.
I've just been keeping a wee eye, but there's nothing else that's came through yet. We'll sit here for a wee bit longer.
No, I'll chat with it. I think headlines from the webinar is it is an intensive course. There is minimal holiday weeks. So the big sort of opportunity for holidays are maybe at the end of the trimester here. Tri-A finishes in December, and then we don't get you back till sort of the end of January here. So you usually got sort of 4-5 weeks holiday at the end of the year. In between trimesters, again, there might be the opportunity for the odd week, but we don't have sort of set holiday weeks as such. So it is quite an intensive course. However, because we have quite small cohorts, so we've currently got our current year 1 is 13 students, you bond very, very quickly to your peer group, and you get to know the teaching team and the students in the year above you and the MSc and then the BSc students really, really well. So you have a lot of support around you, which is really nice, especially if you've moved somewhere differently or you're returning to study and things like that. And we do have a variety of different backgrounds. So a current year 1 We have got people that have done like anatomy degrees before, but we've also had people that have worked in electronics. We've got people who were, I think one of our students was a chef. She used to be a chef before she came onto the course. What else do people do? Anyway, whole variety of different things. And so it just makes things a bit more interesting. And as I say, people do have this, strengths and weaknesses, and everyone sort of learns from each other. And the teaching team, because we've got such strong clinical backgrounds as well, it really does help. If you encounter an issue on clinical, or you don't understand how a particular academic concept fits with clinical, we always, we can advise you accordingly and sort of help you understand that a lot better. I've just got distracted because Ibrahim's come back. So what's the student success rate for this course? Very high, very high. So we have, in terms of attrition, which is the term we use when we're relating to people sort of dropping out, it's usually happens at the beginning of year one. And that's often because of the demands of the course. When people start, it's maybe that they're not able to be in lectures for 3 or 4 days a week and things like that. So year one, we had 15 students that started on the course. We've currently got 13, and everyone has passed modules. We've got no issues with progression in that way. In our year two course, we've got 8 students. I think we started with 12, so we've lost 4. The reason we lost people was, again, 2 people sort of dropped out early on because of the demands of the course. 2 people became quite poorly, so they took something called time out. They stepped off the course because of health reasons. 1 is just coming back this year. So yeah, there's a variety of different reasons why people don't complete the 2 years, but in terms of academic progression, it's usually very, very good. Yeah. Hopefully that's answered the question. Oh yeah, absolutely. Yeah. So the current year ones are the ones to beat. We average mark is well in the 70s. We had students last year getting 80-90% in some of the exams that they were getting, particularly for anatomy. So yeah, they're a very strong year group. But yeah, it's quite rare for us to get an academic failure, and I think that's probably because of the fact we've got this spiral curriculum. So one module builds upon the other, and we're very aware of building up people's academic skills and relating academic content to the clinical environment. They're very good questions, by the way. Thank you very much for all these questions. They're excellent. So I'm just pausing here just in case anybody has anything else. Please don't, if you're worried it might sound a bit silly, doesn't matter. It's better just pop it in. And sometimes what you might think is a silly question is actually a really important question that often other people haven't really, want to say, but reluctant to. So please just pop anything you want down.
Yeah, they've all been great questions so far. So okay, so I don't think there's any further questions then. I think you've answered them all. So thank you again to everybody who's submitted the questions. Oh, sorry, we've got one more come back in. So the pass score is usually 50%. Some universities request 60%.
Yeah. Oh, lovely. This is a lot of questions. It's good. It's good. Yeah. Yes, 50%. So Ibrahim, just to go to your question, it is. So postgraduate, the standard pass mark is 50%. The only exception to that is some of the clinical modules are the same as the modules that are undertaken at BSc level. And so the pass mark for the clinical modules is 40%. So 50% for pretty much all of them, except the clinical modules, which are 40%. We'll explain this to you when you start the course, so don't worry about working out what do I have to pass here or whatever. We will let you know. But as I say, it is very rare for a pre-reg student to get anywhere near 40–50%. It's usually a lot higher. AI is a really interesting one. So there's various different strategies that we are doing to ensure that people are not just putting AI through passing off work that's been created by Gen AI. Yes, absolutely. So there's a few different things. So one, as your programme lead, I'm also the learning and teaching advisor for the department of AHP. So it is part of my job to deal with AI and academic misconduct and things like that in the department. So I've got quite a lot of experience in regards to that. The most simplest way of answering this question is by using lots of different assessment techniques. This is one reason why we do not just use essays as a form of assessment. So what you will find in each of these modules is there's usually at least 2 assessment components. So for instance, for preparation for a radiographic practice, you've got an essay and you've also got an exam. The essay is a personalized reflection. So it isn't something, with AI, it tends to be quite generic and the emotion tends to be quite flat. With the reflective essay, we're looking at you reflecting upon something that actually happened. So often, I'm not saying we're 100% accurate in terms of picking up AI, because I don't think any university can say that, but we are very careful in how, if we're going to give you a piece of written assessment, we're careful in what we're looking for in that piece of written assessment. So yeah, we use a lot of reflective essays, which are quite personalised to you. In other pieces of written work, so the other one I'm thinking of is RP2, which is Sit and Try A. That piece of written work focuses on identifying a patient pathway. So looking at, why would someone have if you've got a query of pathology, like a blood clot in your lung, why would you have a CT scan? What's the patient pathway? What imaging modalities are you going to have to investigate that pathology, and why? And what are the clinical guidelines? And again, excuse me. Again, we are getting you to include lots of different multimedia, and we're getting you to apply the information to a clinical scenario. So again, with AI, often what we find in terms of AI is that the information, if say someone does put it through AI, the information is often not correct, or there are certain tells. So maybe it's not linked to UK practice, or it's not included the correct clinical guidelines, or what it's saying is not, is not what is reflected in clinical practice. So there's a few different things that we look for. Similarly with, there's more of a technical aspect to the essays. Ibrahim, thank you very much for putting that in the chat. Yes, the essays have usually got a clinical focus or a technical focus, and it means that we can hopefully more easily identify whether Gen AI has been used. And similarly with the dissertation project as well, you will be working really closely with a supervisor, and the supervisor will be absolutely monitoring everything that you're doing. And say we have a student who doesn't engage with their supervisor, and I'm going to come to your next point in a minute, Ibrahim, but say we have a person that doesn't engage with the supervisor will meet with the student and make sure that the student understands what the material is. So there are certain things that we do in the university to try and prevent Gen AI being used. The other thing to say is we are also looking at why someone might use Gen AI. You know, is it because they're feeling really underconfident in their written work skills? Is it because they're, you know, scared of getting a bad mark? So again, there are reasons why we put in so many supportive measures in the early stages of modules to help people develop their essay skills so that they won't be tempted to use Gen AI. And Ibrahim has just put their AI check websites to check AI is general or human. Yes, we use things like Turnitin to check for similarity score, but there is certain tells with AI for the time being, and staff that work at the university will undertake a lot of CPD. So we have training to try and identify Gen AI. We put things in place to hopefully stop people being tempted by Gen AI in the first place. But there's no system that's fully 100%, but we try our best to try and identify use of AI and prevent people wanting to use it, really. That's quite long-winded. Sorry, hopefully I've not got over time.
That was excellent. I'm just conscious. Oh, there I am. I'm just conscious of time, so we've just got about 9 minutes left in the allocated time slot. So this will be, I know I've said this a few times now, but this will be one of the final calls. We've had some great questions come through, so thank you all for asking so many. If you have any more, this will kind of be one of your last chances on this platform, but if you've got any questions at all before you start or reply, or before you get your offer or anything like that, you can always contact our inquiries inbox as well. So, but this will be kind of, there we are, one's come through. Oh, there you are. The session was very informative. Thank you very much both, and have a great day.
Thank you, Ibrahim. Yeah, fantastic. Thank you both. It was lovely to see you again online, and hopefully see you in January, Ibrahim.
Perfect. So, don't think there's any other questions. No, okay, so thank you again to all of you who have submitted them. Just want to say a massive thank you to Lucy as well for a really great presentation and for answering all your questions, obviously so thoroughly there as well. As I mentioned previously, the session will be recorded and emailed to all your attendees, along with a link to the presentation slides as well. Like I said as well, if you have any further questions, just give us an email at inquiries@gcu.ac.uk. So we hope to see you all for your induction, where you'll get to meet Lucy and the rest of the team in person. So Lucy, do you have anything else that you would like to say to kind of wrap up?
Just say, if you are able to come to induction, please come to induction, because there's a lot of information that we give you, and it's all designed to help you integrate in the university and meet your peers who are lovely.
That's perfect. Thank you very much. So that's us.
Thank you very much, everybody. Bye.